if I may address the Minister. One of the things that's been really clear this year, actually, through the COVID crisis is the impact on staff from a human level in terms of the stress that they've had and, the impact of, in particular with COVID, how that's affected their lives more broadly. And one of the things that occurs to me in this situation is we've talked about culture, we've talked about staffing numbers, we've talked about leadership and so on. I just wondered whether there's any plans, or if there is in place, mental health and more so mental well-being support for staff who've had to also go through the trauma of seeing somebody lose their child in front of them, because that must have a massive impact on them. So if you could elaborate on the mental health side, I'd really appreciate it.
Thanks, Dean. Well, we know this is a huge interest of yours, and I think you've established, is it 1,000 mental health first aiders in your constituency?
Yeah, that's the training programme.
I mean, that's incredible work on mental health, and mental health is obviously the other part of my portfolio. And, you are a trailblazer in terms of what can be done by individuals in their areas, Dean, and it's just, huge, both in terms of suicide prevention and mental health. But yes, you're absolutely right. I think it's fair to say NHS staff are exhausted. They're exhausted because they have seen, they are used to dealing with patients who lose their life, sadly. Not every story is a success story, but the rate at which both nurses and doctors have had to experience patients, young patients, rapidly losing their lives, the turnover, the barriers that COVID restrictions are, the turnover, the barriers that COVID restrictions are put in place in terms of the normal interactions between family, staff and patients. They've all had their toll package of care and support for staff, which includes access to 3 counselling sessions. It includes IAPS, one-to-one services. But, people like Sarah Jane, CEOs of Trust as well, have also put in their own layers of additional measures as well. Each trust has done something different. I've spoken to a trust which has put in a standard debriefing, buddying time for staff at the end of the day. So there is the mental health support, and the funding has gone in to support the mental health of staff across the NHS. In terms of maternity, we did not, I don't know if Sarah Jane's will contradict and say something different. My understanding is that no midwives are moved from maternity units because babies didn't stop coming. A full term was still full term, but babies arrived when they were supposed to arrive. So no midwives are moved from maternity into red areas or into COVID areas in general hospitals to assist. They stayed in maternity units. And where life continued without, for a while, birthing partners even present at scans, we changed that. We altered the guidance to allow both birthing partners and scan partners to accompany women on their pregnancy journey at times when they needed that help and those partners the most. So in terms of the mental health impact, I don't want to say it's been less prevalent in maternity units because because babies have just continued to come. So life has, but everybody's had those additional pressures of going to work, delivering babies and dealing with COVID in their own lives and in their own hospitals. So it has had a pressure on everybody, even those not working in the COVID frontline or ICUs. Everybody has felt it. But I think NHS England and improvements have been, and I know Sir Simon Stevens himself, Claire Murdoch, Professor Tim Kendall were at the front of this, ensured that very quickly they got a very robust wraparound package of mental health in support in place for all NHS workers.
Thank you, and thanks for your kind words as well. I appreciate them. On a slightly different, a very different point, if I may, I spent some time volunteering in a maternity ward office, and I have to say, I'd never seen elastic bands quite so big, which were holding together many files of documents and paperwork and so on. And it seemed to me that there's an awful lot of time being many files of documents and paperwork and so on. And it seemed to me that there's an awful lot of time being spent by back office staff, because often when we talk about the NHS, we talk about nurses and doctors. And I found was actually the sheer amount of paperwork. And I just wondered whether there's much work going on to digitise the NHS at that level. I know in my local hospital they're doing an incredible job of doing that, but I was interested if there's any plans on that, in particular around maternity, because that seems where the files are the biggest.
Well, that's not in my portfolio, NHS Acts, but I'm sure work. I mean, Sarah Jane, would you like to comment on that? The amount, and you're quite right, Dean, to actually highlight that all the people who do contribute to the smooth working of the maternity unit, we do focus on midwives and obstetricians and gynecologists, but actually there is a whole back team supporting that work that takes place in the labour and the delivery suites. So Jane, do you, I don't know what it's like in Birmingham, but would you like to?
Yeah, so this is another part of Maternity Transformation Programme. It was embedded in Better Births that we did need to digitise maternity care records, not just for the staff that are using the elastic bands and needless to say, occasionally a fax machine as well, but also because we want to move the ownership of that record to women themselves, so they feel that that's their maternity record, that they own that along with the clinicians leading their care. And if it's digitised and people can have access, particularly on a smartphone, then that becomes quite revolutionary in terms of personalised and safe care, as well as just moving something from paper to an electronic system. So we now do have women, over 130,000 women have got access to their own digital care record, which is a fantastic achievement, but we know we've still got quite a long way to go. So we are working with our colleagues at NHS X and Digital to deliver that, because we recognise how important it is. In my own organisation, Birmingham Women's and Children's, we actually moved over to a digital system. And just as I was saying, it was not just about sort of making things more streamlined and less paper around. It was transformational in terms of safety as well. So I recall a lady telling me on one of the inpatient wards that it was transformational in terms of safety as well. So I recall a lady telling me on one of the inpatient wards that she'd been taken really ill while she was in a very Birmingham. And she was able to access her maternity care record on her phone and show that to the clinician, give a safe care to her. And it was a completely different outcome from that which would have happened if there wouldn't have been access to the record. So I think we need to think about this as a really important plank of safety as well. So huge progress made, but I'd love to be back in 2 years' time telling you that this was now universal and that everybody, all units have got an electronic patient record for women, and that all women that wanted to, because not everybody does, but all women that wanted to had got access to their record.
Thank you. And I noticed Dr. Jolly had his hand up to come in on this as well. Thank you very much.
Sarah Jane's done an excellent answer, actually. So, the move to digitalisation is underway. We've got lots of support from NHSX on that. And what's really exciting is that there's also work underway to use this technology to improve safety. So there's the Tommy's group hosted at the Royal College of Obstetricians and Gynecologists are looking at how we use those digital data for identifying people who need to have extra intervention, extra support, and implement best practice pathways. So as Sarah Jane says,